You may begin your clinical encounter.
Come in.
Good afternoon.
Hi.
I'm student Dr. Richard Gardner. I'm here to do an assessment of you today.
Okay.
And are you Mary Roller?
I am.
Okay, what would you prefer to be called today?
You can call me Mary.
Okay, Mary. So I'm just going to go ahead and wash my hands while you give me the lowdown on why you're here today.
Okay. Well, I fell off a ladder and hit the back of my head.
Okay, when did you do that?
It's probably been about an hour ago.
Oh, wow, okay.
Yeah.
Did you lose consciousness?
No. No. I saw stars when it
Okay.
first happened, just for a few seconds, and it hurt like beyond crazy hurt. But I feel better now.
Okay, good.
You know, so.
Okay.
And my husband brought me up here, and I really don't think this is like a, serious or a big thing, but he was really concerned.
Okay, how high up were you when you fell?
Well, it was an 8-foot ladder, and I was about halfway up, and I was putting boxes up on a shelf, and just lost my footing, and just fell backwards. I think I missed a step and just fell backwards and smacked my head.
Okay. You didn't land on anything first, you hit your head down on the ground first.
Right.
Okay.
Yes.
Okay, well, I can't imagine that's pretty scary.
Yeah.
Sorry to hear that happened to you.
Thank
You
you.
shake your hand now.
Alrighty.
Okay. So about an hour ago this all happened.
Yes, sir.
Okay. Has your husband been concerned about the way you were acting at all? Has he noted anything abnormal about you?
No, not really.
Okay.
And I was fully aware of everything. It just scared him, I guess, and
Okay.
But he hasn't said anything about that I'm acting different or anything like that. Just scared, wanted me to get it checked.
Sure. Definitely. You didn't notice any blood or anything like that? You didn't cut your head open or anything?
I didn't know.
Okay. And like you said, you didn't lose consciousness, but you did see stars.
Correct.
Okay. Good. So you lost your footing. Did you feel dizzy prior to?
No, I didn't.
Okay.
I mean, we're spring cleaning and just hurrying, busy, putting boxes
Sure.
up there and just.
So kind of in a rush.
Yeah, and I mean, it just happened so quickly,
Right.
and I think I just didn't quite get on the step, and I just tumbled back.
Okay.
So.
You haven't ever fallen before, have you?
No,
Okay.
I have not. Not this first time.
Okay. And have you had any imaging or anything done, or is this the first point of care that you've had since you fell?
Yeah, you're
Okay.
the first one.
Okay, so we'll probably go ahead and scan your head today at some point.
Okay.
And make sure that there's no active bleeding within the brain. That doesn't mean that there's not, because sometimes bleeding can start 24 hours after we do a scan. And so I think the best thing to do is kind of watch you for the next day, especially in your age range. And I think that maybe bringing you into the hospital so they can observe you for the day, or at least 24 hours from an hour ago, to make sure that nothing develops in that time, because we don't want to send you home and then something bad happens.
Okay.
But in the meantime, I'll just kind of ask you some questions so you get you ready and send you over there, okay?
Okay, sounds good.
Okay. So you've never fallen before, you didn't lose consciousness. Have you had any shortness of breath?
No.
Okay. Any chest pain?
No.
Have you had any fever?
No.
Any weight changes?
No.
Okay. Any problems swallowing?
No.
Okay. Any blurry vision after it happened?
No, I mean, I felt fine, just have a headache.
So you have a headache now?
Yeah.
Okay, how would you describe that headache?
Well, I guess the best way to describe it is like pressure in the back of my head. Like just a pressure back there.
So it's
and
not
it was
painful?
tender back there too.
Is it painful?
Well, I mean, to me it hurts, but nothing like it did when I hit it.
Okay.
So it's not as bad as when I hit it.
Okay. Okay.
But it's there.
You don't have any past medical diagnoses, do you?
I don't.
Okay.
I'm really pretty healthy.
Okay. Any surgeries in the past?
No.
Are you allergic to anything?
I'm allergic to sulfa.
Okay. And what's your reaction?
I have a rash.
Okay. Have you ever been hospitalized before?
No.
Okay. Are mom and dad still alive and well?
They are not. They passed away in a car accident.
Okay.
But they were healthy at the time.
Okay.
No.
How long ago was that?
That was 5 years ago.
I'm sorry to hear that.
Thank you.
It's a bit hard.
It was hard.
Are you on any medications or supplements currently?
No medications on a regular basis. I took some Tylenol.
Okay.
I don't know if I've already said that. But I took some Tylenol.
Right
my
after you
husband-
hit your head?
My husband gave me some Tylenol, just, like,
It wasn't
over the
ibuprofen or aspirin or anything like that, was it?
no.
It was just acetaminophen Tylenol? Okay.
Yes, that's all
Okay.
it was.
Do you know what the dosage was on that in milligrams?
I don't. I think I buy like extra strength Tylenol, but I don't know.
Okay.
I really don't know. And I think that helped me. I
Okay.
think it did. But
Has anything made it worse?
Medication.
Oh, I'm sorry to interrupt you. What were you about to say about that other medication?
No, I just said no other medication,
No
just
other
so I
medication.
didn't confuse you there.
Nope, that's perfectly fine.
What makes it worse really is just movement. Like if I move around a lot, that makes it worse. Just a headache. I guess you call it a headache.
So it's like a pressure headache?
Just a pressure headache right there. Yeah.
Okay. I'll go ahead and take a look at it as soon as I can.
Okay.
Just make sure I haven't missed anything. Do you feel like we've missed anything? Do you have any questions before I go ahead and take a look?
No.
Okay.
No.
Alright. So I'll just take a quick look, and then just to make sure everything else is okay, I'll just go ahead and listen to your heart and your lungs. But let me first go ahead and take a look at the
head. Okay.
That works. So you said it was in the back here?
Mm-hmm.
Okay.
Yeah.
I'm just looking for any signs of bleeding or anywhere you might have been cut.
Okay. It just feels tender.
Or any swelling or anything like that.
Okay.
So back here, is it tender as if I poke around here?
It is.
Okay.
It is.
Okay. Alright. And actually, I'll go ahead and kind of test some other things out before we go ahead and listen to heart and lungs. So if you can just follow my pen here. Good. Okay, and then stare here at my finger, and I'm going to shine a bright light in your eyes, okay?
Alright.
It's not that bright, because I can't even see if it's on.
It's really not.
Okay. Can you squeeze my fingers? Hard as you can. Tight, 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 tight. Good. Okay. Can you push up against my hands? And now pull down. Good. And then back up here. And pull against yourself. Pull against that. And now push. Good. Okay. Same thing. Push up. Pull down. Pedal to the metal.
Oh.
And up.
That was good.
Push against me. Pull down. Pedal to the metal. There you go. And push up. Good. Okay. And I'm going to go ahead and just test the reflexes here. quick little neuro exam and everything kind of checks out there.
Okay.
But like I said, I still want to kind of get an image of your head and make sure nothing else is going on now. And that doesn't mean something might not be happening. So that's why we want to keep you in the hospital maybe overnight to see if everything checks out. So we'll go ahead and kind of send you to the ED, and they'll do another assessment there, and then they'll get you upstairs and kind of situated. Okay. Do you have any other questions for me?
I don't think so. I think you answered all my questions.
Okay.
I was just hoping to get in and out of here, but
Yeah, fall in your age group is kind of scary, and we want to make sure you're not on any medications that make you worried that you might be bleeding or anything like that. You have no past medical history. It's just a fall from that height in your age group on the head, directly on the head. It's something that we kind of want to follow and make sure nothing's going to happen. Like I said, though, I do want to listen to your heart and lungs before I get out of here, and so if you could just take your gown down, and I'll just go ahead and first inspect your chest.
Okay.
You didn't fall anywhere else. You kind of just hit your head, and no
Right.
injuries anywhere else.
No,
Okay.
I didn't hit anything else.
And I'm just going to take a quick listen here. And then if you could just lift your breast so I can get access to the last point here to listen to.
Yes.
Good. And you can go ahead and kind of down back up a little bit, and I'm just going to need access to like right here.
Oh.
And big deep breaths in through your nose and out through your mouth. Good.
Two minutes remaining in the encounter.
And you can go ahead and down all the way back up. I know you want to get in and out of here. Do you have any concerns or anything like that?
I don't think so.
Okay, so we'll go ahead and kind of order that imaging that you'll get at the hospital, make sure everything's clear there. But
Okay.
like I said, I probably want them to watch you overnight.
Okay, sounds good.
Okay.
Thank you.
All right,
very
Mary, it
much.
was nice meeting you.
You too.
I'll see you soon, okay?
Okay.
And I'll probably, after they have you, probably have you follow up in a couple weeks, or depending on what they call and tell me
Okay.
after your stay, okay?
Okay.
All
All
right.
right. Sounds good. Thank you.